So get ready with me for my detailed anatomy scan appointment. I'm seeing maternal fetal medicine, so pretty much every appointment is an anatomy scan, but this one I'm a little over 21 weeks, so it'll be more of a detailed anatomy scan. Last time, about 4 weeks ago now, they noticed I had marginal placenta previa. So I've been on pelvic rest for the past month. So hopefully, as my uterus has grown, my placenta has moved up and is nowhere near my cervix, because C-section is my biggest fear. And they weren't really concerned about it because 93% of cases do move on their own as your uterus grows. So I'm hoping that that is the case today. And we can just mark that concern off the list. And everything is good there. Another thing that they noticed, which I'm not too concerned about because we had genetic blood work done, was that they noticed a kind of like a shadow or something like that on the view of the baby's heart, which ironically enough has nothing to do with the baby's heart. It has to do with genetic abnormalities like Down syndrome. But we had genetic testing and everything came back normal there, so they're not thinking that that is a concern. So it might have just been a fluke, I'm hoping. So we'll have that appointment here in a couple hours, or a few hours, I guess. And hope those two things are no longer a concern and there's no new concerns with baby boy. But yeah, 21 weeks and a few days now, almost 22. And yeah, have my detailed anatomy scan appointment. But they did get a good select images last time. Like I said, with MFM, every appointment is an anatomy scan, really. Looking at everything with baby from your first appointment on. They'll also, I'm sure, will check my cervix in general, because with my first, he was born at 34 weeks and 6 days. So a little over 5 weeks early. And I had an incompetent cervix. He started trying to come out at 30 weeks, I think I was. I hardly ever braid my hair, and that little thing is getting on my nerves, but out of sight, out of mind. Anyways, he started trying to come at 30 weeks, and I went to the ER or labor and delivery, probably every weekend for like a month until my water finally broke, and there was no stopping him at that point. But before then, I would have to go get medications to stop my contractions, but this was the first time that my water actually broke. And then we realized then also that I had gestational hypertension, which I had with all my pregnancies apparently. I had it with my daughter as well, so they're monitoring that. I had her at 38 weeks after my blood pressure was high and her heart rate was a little elevated, or happy, as they put it. So they went ahead and induced me, but I'm pretty sure I was in active labor that day, because when I got to the labor and delivery unit, I was already 4 or 5 centimeters, and I had been having like contractions all day. Why they still induced me, even though I'm pretty sure I was in active labor at the time, is beyond me, but it did speed things along. So I was ready to get her out at that point anyways, and that was at 38 weeks. So yeah, they're monitoring those two things, and we'll see when this baby decides to come. Stay tuned, and I will post the update on how this appointment goes later.